Hi, this is your host, and you're watching this channel. When you think of the Middle Ages, you might imagine men in tights jousting while people in the crowd watch from behind velvet ropes. But that vision isn't exactly accurate. For one thing, velvet ropes didn't become popular until centuries later. And for another, there were no jousting matches happening in the streets, because Europe was busy trying not to kill each other during that time period. So if you don't mind us taking a little detour from our usual fare, we'd like to show you what life was really like in medieval Europe. Specifically, we'll look at some of the things that kept people up at night. Whether it was a bad case of the runs or a leech attack, here are 5 ways the Middle Ages would haunt your molars. 1. Canker sores. Canker sores are those shallow, painful ulcers that pop up inside your mouth, and though they aren't contagious, they can be pretty uncomfortable. The good news is that most of them clear up on their own after a week or so. The bad news is that the cause of canker sores is still unknown, meaning there's no way to tell when they might strike again. If only modern medicine had an answer. Well, it turns out that Jewish folklore believed that canker sores were caused by something called hot milk syndrome. Basically, eating dairy products that have been left out too long will upset the balance of humors in your body, leading to pain and inflammation in places like the mouth. Even worse, milk wasn't the only food that could affect your health. It was also thought that eating certain vegetables like cucumbers and radishes could lead to painful sores. To prevent getting a canker sore, medieval Jews were recommended to avoid these foods altogether. They were also told to stay away from spicy food and acidic fruits, like oranges. Although this advice sounds reasonable enough, it meant that many people had to bid farewell to some of their favorite foods, just in case. So if you're feeling adventurous, you might want to steer clear of any spicy cheeses and cucumber sandwiches. 2. Wandering Jews. We've said it before, and we'll say it again. Leeches are creepy crawlies that shouldn't exist. And if you need more proof than the fact that they're blood-sucking worms, consider that the mere sight of a leech used to be enough to send medieval Europeans into fits of anxiety, known as leech fasters. These people claimed that a single glance at a leech was enough to send one into convulsions. But even if you never saw a leech, you might have worried about wandering Jews, a mysterious group of beggars who showed up in medieval Europe claiming to be Jewish, although many historians believe they may have actually been Christian. In order to avoid being taxed, these groups traveled around begging for money and food, which put them in close proximity with medieval folk, and since they were constantly on the move, there was no way to know whether or not they were carrying any diseases. Of course, medieval Jews were often victims of anti-Semitic persecution, so it makes sense why people might be wary of them, but there was no concrete evidence to suggest that Jews were inherently dirtier or more likely to spread disease. That notion came from persistent anti-Semitic stereotypes. Nonetheless, the idea of wandering Jews stuck around, and it probably didn't help that they were usually described as having disgusting habits and wearing filthy clothes. So if you happened to encounter a group of these traveling beggars, it would have been wise to keep your distance. After all, nobody wanted to risk catching whatever disease they might be carrying. 3. A tooth that won't quit. Toothaches are the worst. Not only do they feel like someone is chipping away at your enamel with a tiny hammer, but they also come with an unpleasant side effect. Fever? Well, not technically an unpleasant side effect, considering that fevers are usually the body's way of fighting off an illness. But medieval people didn't understand that, and they also didn't have access to painkillers. So when a toothache wouldn't quit, they tried everything from pulling the tooth themselves to sticking a red-hot musket ball in their gums. Those last two might sound pretty awful, and they were, but there was another treatment option that was arguably worse. Letting the tooth worm out. Sounds kind of disgusting, doesn't it? That's because it is. Basically, once a tooth started hurting, people believed that the best thing they could do was make room for a new tooth to grow underneath it. The problem was that the only way to do this was to infect the tooth and let it rot away until it fell out. Yikes. Thankfully, doctors understood how ridiculous that strategy was and rarely recommended it. Still, it was unheard of for people to take matters into their own hands and get rid of a troublesome tooth that way. But if you were smart, you'd put up with the toothache instead. After all, nothing says pleasant dream as counting sheep while lying in a pool of your own drool. 4. The plague. Even today, there are few things that can ruin a party faster than an outbreak of the bubonic plague. Back when it first hit Europe in the 14th century, however, people didn't even realize how bad things would get. The plague arrived in several waves, with the first one occurring in the 1340s. Although the death toll was staggering, it wasn't nearly as high as it would be during later outbreaks. So it wasn't long before people started ignoring warnings that more was on the way. Unfortunately, the second wave of plague, which hit in the 1360s, was just as deadly as the first, and the ignorance hadn't changed much. People still thought that the best way to treat the plague was to cover up the symptoms rather than seek medical attention. As a result, entire villages were wiped out, and the lucky ones simply ran away. The Black Death was so devastating, in fact, that it killed somewhere between 75 and 200 million people, or around 30 to 60% of the population. Needless to say, it haunted the nightmares of medieval Europeans 4 years afterwards. 5. Bloodletting. When you cut yourself, your body does a clever trick. It sends platelets to the injury to stop the bleeding. These guys work overtime to plug the hole in your skin and protect you from infection. Unfortunately, medieval doctors weren't aware of this process, and they certainly didn't know anything about germs. So whenever someone got a cut, scrape, or bruise, they knew only one way to stop the bleeding. This involved cutting or leeching the affected area to remove some of the bad blood. But this was not only useless against infections, it was often fatal. Once the good blood was gone, patients became weaker and weaker until they eventually died. Even worse, doctors thought that bloodletting could prevent illnesses, so people would have the procedure done regularly, sometimes multiple times per year. Since they didn't use anesthesia either, it was both a painful and terrifying experience. Eventually, the practice was proven to be ineffective, but it remained popular well into the 19th century. Which of these would haunt you the most? Let us know in the comments below, and thanks for watching.